Good morning, everybody. Appreciate the, Janet, thank you so much. Thanks for the opportunity to get in front of everybody. My name is Ryan Moore. I'm with Twin Health. I'm in charge of our employer sales division. Live in St. Louis, so not very far away at all. This is Marissa. Marissa,
He's my boss.
Yes, Marissa is in charge of the Wisconsin area, and would love to, collaborate with you all further and kind of discuss it. If you don't remember anything I'm about to tell you, Twin Health is a cardiometabolic solution. We look at healing the root cause. We don't push pills, although we'll use them, but we don't push them, and we don't push a specific diet. We don't push pills, we don't push a specific diet. We feel it's very important to heal metabolism, which is easy to say, but hard to do, right? So one thing I always ask people is, you don't have to raise your hand, but we're in March, we're way past the New Year's resolution point. I know that a lot of people have tried different diets, it's hard to sustain them. And the reason is because a one-size-fits-all approach to losing weight and healing your metabolism doesn't work. It just doesn't work. But now the innovation is here for it to work, and it does work. So we're going to take you through that. We're going to take you through the innovation, but we're also going to take you through the clinical studies and the results that we have to prove it. Does that sound good? I think hopefully it'll be interesting to you all. So I like to start telling people about Twin Health by telling them about our founder, this handsome fellow here named Jahangir. So if you're my age, you'll know that you guys ever use a BlackBerry. Back in the day, you had a BlackBerry. So he's a technology guy, he's not a doctor. And so I think that's a very important distinction to start off with. The reason I brought up the BlackBerry, this little cell phone Wi-Fi thing in the BlackBerry, remember the thing it could toggle between, you're like, wow, it could do both. Like that was his company, that was his first company that he started and sold. His second company that he started and sold is called Jasper. So Jasper was the internet. Have you ever guys heard of the Internet of Internet things? Do people have heard of it? So think about putting sensors around really complicated objects like a Formula One race car, a Boeing jet engine, and studying it and analyzing it to understand how to make it more efficient. Does that make more sense? Does that make sense? That's called making it basically a digital twin of a very complicated object. That's where we get our name, Twin Health. So we've been around about 7 years, but in 2016, Jahangir sold his company to Cisco. He goes back to celebrate with his family, and his mom and two of his sisters, they were just recently diagnosed with type 2 diabetes. So he's fascinated by this, like, that's terrible, tell me about it. They all had different answers. They were given different advice, they were given different things, eat this, don't eat that. And so what does a system engineer do? Like, he wants to solve the problem. He knows enough about medicine that you can actually you can reverse type 2 diabetes in many cases. Your body can heal, right, from that. So he's like, okay, the body can heal itself. I'm going to put sensors on these people, and I'm going to figure out their metabolisms and how to heal them, right? He's a systems engineer. That's how he thought of it. That is exactly how Twin Health was born. Those were our first 3 patients 10 years ago. We've been in the market 7 years now. So what problem was he actually trying to solve? So I think he's trying to solve the problem that many of you guys have in your populations today. Their health is getting worse. Cardiometabolic isn't just type 2 diabetes. You look at the form of obesity, pre-diabetes, heart disease, liver disease, kidney disease, all of it's related. All of it's in a big basket, right? And it's going up and increasing, but about 50% of employees are affected. We know claims are rising in this group. And then we know the innovation hasn't been there yet. The technology hasn't arrived yet until now, because traditional care is kind of reactive. You go, and I've done it, gain a few pounds, let's put you on cholesterol meds, you have pre-diabetes, let's maybe do an intervention, give you some general advice, maybe put you on a drug here or there, and see you in 6 months. And it just hasn't worked. And even though we've thrown money at primary care, and we love primary care, we love direct primary care, we are considered the metabolic console in their pocket. We'll get more into that. Other digital health solutions have come and said, I got the answer to this. We're going to solve this. We're going to everyone's on keto. Everyone do keto. And it's like, okay, well, keto can work for a small portion of people for a not a very sustained amount of time. Does that make sense? So it'll work. But can it work for years and years and years and years? And the answer has been no, because if it did work, everyone would be on it. We wouldn't have all these issues, right? And then we've all heard of GLP-1s, right? That's a joke. We all have heard about GLP-1s. It's increasing costs, but are they working? Are they sustainable? Are they for everybody forever? Do they have side effects of nausea? The average person's on a GLP-1 about 6 months, 7 months. After they get off it, they gain weight and they're more sick than they started in many cases. Now, are they a good tool? We'll get into GLP-1s and hopefully have your attention with that. We use them as a tool, but they're not for everybody forever, and you have to look at the duration. Some people will use it as a tool. It's someone's A1C's out of control, and we got to get their weight down. We'll use it as a tool, but we also are on the road to deprescribing that eventually. Does that make sense? So that's how we view it. So what Twin is trying to solve is the root cause of dysfunctional metabolism. That's what we're trying to solve, is the root cause. And that is not an easy thing to solve. So this map here, it looks like, I don't know what that looks like a map of a nuclear reactor or something. That is, early on, we mapped one person's metabolism. This is what it looks like. This is all the fact. It's like a fingerprint. Everybody's in this room is different. And you have factors that make their, so this is what you're born with, right? Your own metabolism, but then your age, the meds you're on, what you eat. Are you a night shift worker? Are you a truck driver? Are you sedentary? Are you on a lot of stress? That changes your metabolism big time. And so what you have is you try to throw a one-size-fits-all solution at this, and there's no way it's going to work. It's going to work for some people. And I started off with that question: how many people started a diet and it failed? This is one of the reasons why. You hear, I mean, I was the person who would, I'm going to try Noom this week, and I'm going to try MyFitnessPal. I'm going to try this and that. It's just like I wasn't getting to what would heal my own metabolism. So the way Twin was built was very, I think, it's very refreshing for a digital health company. You hear a lot of them that are like kind of launched with a bunch of marketing, and they're kind of like flying the plane, building the plane as it's flying. I think is the first thing with that Jahangir did was saying, okay, we need to patent this and we need to figure this out in the AI and nail it. So we have a patent. We're the only folks that can create a digital twin of a human being to heal metabolism. That's kind of cool, right? Long patent on that. That's where we get our name, Twin Health. We are literally creating digital twins of people. It's fun. We'll get more into that. But it's more than the technology, and I really want to emphasize that. We have health coaches. We have physicians. We have sensor specialists. We have nutritionists. We have all these people that surround the member. If you just throw AI and an app at them, it'll work for maybe, we think 10 or 15%, 20% of that population. The rest, like, we have people that get the app, they get the sensors, and I'll go over that. They're like, I'm good to go. About 60% of those people are like, need to talk to a caregiver every day. They need to interact with a health coach and nutritionist. They just need more. We have that. We'll go over that. The other thing we did before we fully launched in the market is we partnered with the Cleveland Clinic on a randomized control trial. The only one, so if you're comparing cardiometabolic solutions, the only one that has a RCT, a true RCT at the Cleveland Clinic, which is pretty good primary care, and Twin, Marissa's going to go over those results. That speaks for themselves. We're the only ones with RCT, and I don't want to be spoiler alert to your part, Marissa. It wasn't even close. Like what we're able to do when you put Twin with really good primary care, and we talk to that primary care, we set up that link, which we do with lots of DPCs and lots of primary care docs. It really can solve this. We really can solve this now. So the three legs of the stool, I'm going to go real quick, and then I'm going to give it to Marissa on the clinical results. This digital twin is with you all day. Well, that sounds weird, but it shouldn't. It's nudging you and guiding you every single day based on your metabolism. So are you stressed that day? What have you eaten that day? What meds are you on? What activity level you're at? And it's giving you best options all day long, not just in the past. So have you guys ever heard of a continuous glucose monitor? Like those are kind of the rage right now. You see all the commercials. That's cool data, but it's like telling you like, all right, now what do I do with that? My glucose went up, now what do I do? Like this is actually giving you action on what to do in the moment, but also what to do in the future to affect that glucose spike. Does that make sense? So that's what the digital twin is. Again, we're a solution. So we work with mostly self-funded employers. We also work with some fully insured as well. But our solution is type 2 diabetes, pre-diabetes, and healthy weight. Typically, BMI is set around 27 and up are the folks we work with. So how is it? Anyone curious how this thing works? So here's what I get a lot before I get into like the how it works part. 75% of our members are frontline blue collar workers. 75%. That's who our solution's for. So we had to make the tech really easy. So if you think about our population and who we serve truck drivers, we serve manufacturing facilities, we serve non-desk workers. So we had to make it super easy so everyone can use this easily without having to fumble around with the technology because just stop it, I'm not going to use it anymore. Super easy. You get a kit. It has a CGM. You go get your labs done. It's a full set of labs, not just your standard labs, the 5 standards, but we go into insulin resistance. We go into inflammation. It's a big set of labs. Blood pressure monitor, a Garmin activity tracker comes with it, and an impedance scale. Once you get your setup, you get a call from a sensor specialist, and we are incentivized to get that person set up correctly because this whole kit is sent at our risk at Twin Health. Our entire program's at risk, and we'll go over more of that. So the person gets their CGM on, they get their blood pressure going, they'll go get their labs done, they get their scale, all that at 3,000 data points a day is put into the app. Now we're able to do some pretty cool stuff. We've now had a digital twin of that person, and now the AI inside the app can say, okay, here's how that meal and activity you did affected your body. That cause and effect is like fascinating to people. Like for the first time, they could say, okay, wow, I did that and watched my glucose drop. I did that and I could watch my weight drop. I did that and I feel better. Right? I ate it this time. I ate in this order and I feel better. And the AI is telling you to do that. The other thing, it's not just past and present, it's future. So consider this, like we'll all go to lunch after this, right? We'll think about taking a picture of the menu and the app telling you based on your metabolism, what's the best thing that you can eat to feel the best afterwards and have the least glucose spike and continue that and good for your metabolism. Right there in the restaurant. I did it last night. Take a picture of, boom, eat that, great. I'm a rule follower. I'm going to follow the program. I didn't used to be. So all day long, you're getting this guidance like, hey, like you didn't sleep well last night. Your Garmin tracker said you slept 5 hours. Your glucose is spiking. And it's giving you guidance on what to do based on your metabolism in real time. Does that make sense to everybody? But it's not just I know it's an innovation day, and I want to stress this one point. Very innovative, but we also just have regular old provider teams behind it with smaller panel sizes. And it's paired with clinical experts. Lots of them. So this is our typical member, Owen. We're going to come back to Owen in a second. But the first thing you get, like if you have an employer and you're interested in it, you'll call Twin and say, hey, I'm interested in this. And we'll look at it and say, okay, you qualify, great. That's what your enrollment advisor does. Your enrollment advisor then say, I am now sending you to Quest or LabCorp, and I'm going to set your appointment for you to get your labs. At that same time, the kit is sent out, and then we have a sensor specialist call and make sure they get the sensors on. We don't have a problem with that. Then the primary care team is activated. We have a physician in charge. We have Dr. Bree in this case. She's actually mine. We have health coaches that are amazing. You can chat with your health coach real time. We have 24/7 coverage on that at any time within the app. We have registered nurses, and then you also have your AI digital twin, ask your twin inside the app where you can press a button and like, hey, my CGM fell off. What do I do? So instead of calling you or calling someone else, the digital twin will tell me exactly what to do. I'm shipping a new one and no one has to touch it. So again, people think of like, oh, this is really complicated. We're actually a provider team around an innovative solution. I hope that makes sense. So what does it look like in real life? So I have two folks here, Carla, who has prediabetes, and I have Owen, who's type 2. They have the same meal. Every other program on the planet is going to say, you have a lot of chicken right there. That's great. Like chicken. And you have rice. And most other programs will say, hey, get rid of the rice, just eat the chicken. Not very helpful, right? It can be for short term, but not long term. Like, I don't know about you, but like eating chicken for every meal or the rest of my life isn't great. I like carbs. I like things. We want to meet people where they are. So Carla, her goal, she just wants to lose weight, get her A1C under control. The app has noticed that the AI has noticed that with smaller meals. So have you ever been, I don't know, have you ever been trying to be like really good in the morning and then by the afternoon you're like ravenous? Like, okay, I do that every day. So the app has noticed that, like, if I don't get Carla full, she's going to snack like crazy. That's her pattern, right? So it says, hey, the chicken's good. That's great. Rice is good. It's going to say, before you eat the meal, let's add carrots and spinach. Let's get some fiber in there to sustain fullness. Does that make sense? So then then the app is going to notice she's not snacking as much later in the day. We want to create fullness. And for Carla, her thing's fullness. Like, she's like, if I can remain full and not sacrifice constantly, I won't go, off the deep end and quit the program. Owen, on the other hand, he has type 2 diabetes. We're trying to reverse it. We're trying to heal it. We're trying to get his A1C down. Our other goal with Owen is to reduce the amount of medications he's on. Like, our people, and you'll see in the clinical study here in a second, our people, they get off insulin. They get off their GLP-1. They can get off their metformin. Like, it's real, and it can happen with the right program. So with Owen, we're like, hey, that's great. We want you to be full too, but you're type 2 diabetic right now. We haven't reversed it. We're still working with you. Swap that for cauliflower rice. Then we could actually predict before it happens, based on their metabolism, what their glucose spike's going to be. Within like 96% accuracy. It's pretty wild. Like, I could take a picture of something like, based on my metabolism, it could go up, 26 points. Marissa's may go up 12 based on her metabolism. Does that make sense? We do color code our food: red, orange, and green. So you've seen that probably scale before. Here's the crazy part, or interesting part. It's not crazy, interesting. What's red for me at first might be green for Marissa. What's orange for me could be red for you. It's not like it's the same food for the rest of your life. The other thing is, what is orange for me when I started the program earlier this year becomes green when my metabolism heals. I love when things become green. I like it a lot, because like literally you'll get a pop-up saying, hey, we noticed this is a food you ate that was orange in September. It's now green, and you can have that. You can have it. Do you know like liberating that is for people that are on diets and struggle with this? Like, my metabolism will heal. I can handle this food and enjoy it with my loved ones and enjoy experiences. So the other thing I want to know is, like, it's not just about what you eat. It is about activity as well. And walking's great. I love walking. I have a dog, walk the dog, it's great. But we also need to build muscle. So when you ingest glucose, there's a couple things places it can go. It can go into your fat cells. That's suboptimal. Or you can use it, or it could be stored in the muscle. If the muscle is already full, though, it's going to be stored in fat cells. So a lot of times what we do is say, hey, your glucose just spiked, go on a 15-minute walk. Or we tell them that before they eat the meal. But we just partnered with Peloton. Anybody who has Twin gets free Peloton. It's kind of cool. You press the button, it goes right to Peloton. It's free. And the cool thing about the Peloton is it meets you where you are. If you're stressed, and if you had like a terrible night's sleep, it's going to may suggest a low body weight exercise or yoga. But once you get advanced, it's going to start challenging you. You don't need a bike. You don't need a treadmill. It's just the hardcore pellets. You can get hardcore as you go or start off easy, but it's about building muscle. Like, that's one of the keys to this whole thing is building lean muscle. If you're on a GLP-1, your lean muscle mass goes down. Even though you try to fight it, it just really does. So a lot of times when we're titrating down a GLP-1, we're like emphasizing big time. And the impedance scale shows the patient's muscle mass every single day. So we know what their muscle mass is, and we're suggesting building muscle to them. And in fact, our physicians are trained, like, if they don't have enough muscle mass, you can't titrate that GLP-1 down as fast, because they won't do as well off that medication. Yep, Tim, thank you. So who's going to use this? People are like, this sounds cool. Who's going to use it? Is it hard? Again, we have 200 clients plus. We've been around for 7 years. People use it. And once they get engaged, it's like they're engaged. Like you've never seen engagement. So why? It's based on, have you had that based on your metabolism? It's pretty cool. Cause and effect is pretty awesome. Results are pretty awesome. You're getting your lab work done 4 times a year. Again, that's all on us. We'll go over the financial model, but pretty awesome. Like the cause and effect, and it works so well that after 1 year on the program, 86% of our members are still going into the app 7 days a week. 91% going in 5 days a week. I have kids. They're on TikTok. I just looked up their engagement score last night. So TikTok 2025 average was 62% of after the first year opening at 5. So we have a higher engagement than TikTok. And like, it sounds hard to believe, but it like once you're in the pro, like you totally get how easy it is and why these folks stay engaged. And one of my people, and when you see some of our testimonials, you're like, well, why do they stay so engaged? I went over a little bit, but if you have type 2 diabetes or your A1C is 12, you don't feel well. And you give them a program where their A1C is dropping and they're getting off medications, they haven't felt this great in 20 years. That's the motivation that we're after. So from a self-insured employer standpoint, all of our fees are at risk. Marissa's about to go over those, and they line up with the savings very well that we'll show you. So we talked about the randomized control trial with Cleveland Clinic. I'm going to have Marissa review those. Yeah.
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 Okay, if there's anything that you also just heard from Ryan is the excitement in his voice. So I am exactly the same way in terms of how I feel about what we're doing at Twin. I have my CGM on, and I invite anybody who is interested after, the meeting today to come back and look at the demo. We've probably both got the app up, and I continuously look at it. It's fascinating. So on that note, I'll just start with where Ryan left off in terms of our results from our Cleveland Clinic randomized trial. And as he mentioned, we are the only solution that has published a randomized clinical trial. And this one was with the Cleveland Clinic. And again, the results pretty much speak for themselves that you can see on this slide. These are kind of the top measurements. I'll talk a little bit more about some detail around them, but you can see here, we basically had 2 types of care. We had a group of type 2 diabetes patients that received obviously gold standard world-class care with Cleveland Clinic. And then we also had a group of type 2 diabetics that received care with Cleveland Clinic, that same primary care, but also had the Twin Health intervention. You can see here in terms of the A1C difference, the usual care at the Cleveland Clinic, we were able to bring down that A1C by about 2.4%. But what the one group that was with the Cleveland Clinic and the Twin Health intervention or solution, we were able to bring down that A1C below 6.5 for 71% of the population. You can see the average weight loss is almost double as well in terms of the solution and the primary care versus the usual care. And what's astounding to me, back to GLPs, which we'll talk about in just a second, is that the usual care at the Cleveland Clinic increased the usage and prescriptions of GLPs by 21%. The portion of the population in this study that was with Twin Health, we reduced the GLPs by 85%. Significant. What's more important to also understand is what else took place in this study. And Ryan started to mention this early in the conversation. All of our systems in the body are connected, right? So we're not just talking about healing one thing, the blood glucose or diabetes. You can see here from this study and what Twin Health is doing in terms of healing a dysfunctional metabolism is also healing your cardiovascular system, liver disease, the MAFLD, that is what used to be known as non-alcoholic liver disease. Significant change versus the usual care group. So I think this is really important to just come back to where Ryan started in the presentation, where we're healing the root cause of a dysfunctional metabolism in all of the systems of the body. So really quickly, I know we want to make sure we have time for questions, but in terms of GLPs, this is a really interesting study that we did too. This first graph that you see up on the slide is very typical, right? It really is showing the blue line is somebody who has been on, or a group of people in this instance of this study that has been taking GLPs. They obviously are losing significant amount of weight when they're starting that GLP. You can see in the pink or the red line with Twin, we also help them achieve about a 3% more weight loss. What happens, again, as Ryan mentioned, when people go off of these GLPs after 6 months, 12 months, whatever the case might be, we know, and it's been proven in the market, unfortunately, that these people are gaining back a lot of weight. When you start a GLP, you're losing fat, muscle, and bone. When you gain it back, unfortunately, it's purely just fat. You're not gaining that muscle mass. You're not gaining that bone back. So it's really important to be followed by a physician, which is, again, an important piece of what we do at Twin with that care team. But what's significant on this slide is that you see that weight gain when somebody went off a GLP without Twin, but with the Twin solution and that care team and the small changes in daily habits that we're making with our members are continuing to lose weight. They're not gaining it back. And then again, as Ryan mentioned, with the Peloton application, our providers and our app, our digital twin, are recommending weightlifting exercises so that we're not just looking at fat gain, we're continuing to build lean muscle mass. So I think this is really significant in terms of GLPs to understand. And again, we are not against GLPs in any respect. We figure they're a tool in our toolbox of things to use as we work with our members. So just a quick note here, just a snapshot of some of the plans we work with, some of the employers we work with. And really quickly, so we have 1 minute for questions. Ryan mentioned this as well. We do a unique billing situation. We only bill for outcomes, clinical outcomes. So we're not PEPM based. We don't have implementation fees or admin fees. We really just bill when members are getting healthier. You can see here by A1C reduction, BMI reduction, and then high cost med elimination. Those are the things that we actually bill for, which obviously on the other end of the spectrum helps employers bring down their medical and pharmacy spend. So I'll stop there and just leave this up, but Ryan and I are happy to take any questions in our last minute or so here. No questions?
Right here.
Oh.
I think one of the hardest things I've heard from people who are tracking their food or use the CGM is that it eventually becomes stressful. They get tired of taking pictures of their food. They think they're doing well, and then their CGM spikes, and eventually they get too stressed out and have to stop. How are you guys solving for that?
I think that's really important. I think in a couple ways. I think the first thing is the health coach that's assigned is super important for motivation early on. We get results pretty quickly with our program. It doesn't take that much time. We're seeing significant results for that patient within 90 days. So a lot of the motivation is coming from the health coach and the doctor. So if we see they haven't logged in a couple of days, the AI will ping the provider and we're calling them. remember, we're at risk for them getting better. So we are very incentivized to keep them engaged. Once they actually start feeling better and losing weight and seeing the effect, we're off the races. So it's typically that first couple weeks. We do make it very easy with the CGM and the sensors, but with the AI tool, you don't sit there and type it in. There's voice. You can take a picture, or you can just, have you guys used like the Gemini or ChatGPT where you can talk to it? You can do the same thing with our tool inside. Be like, hey, I'm at this gas station. I'm at Quick Trip. Like, what's good for me to eat here? And it'll tell you. So it's that kind of, and then it'll log it for you after you eat it. So I think it's ease of use, but also the health coaches and doctors that's kind of our magic that keeps people engaged early.
Awesome. Thanks, guys.
Yeah, thank you.